And one more disclaimer that we would like to make. We are here, as you know, to talk about Opill, which is the first ever over-the-counter birth control pill. However, at Latina Institute, we are not health providers. Our job is to educate, to organize, and to advocate, but we do have limits in terms of what we can say in regards to medication and healthcare. So the information that we present today is for educational purposes only. It isn't legal or medical advice, and we always encourage you all to seek out the advice or help of a medical professional. So jumping into that, we would love to get to know one another. I am Dani. My pronouns are she, her, ella. I am the state field trainer here at Latina Institute based in Washington, D.C. I'm very excited to bring you all lots of good information about Opill today. And we would also love to hear from you all. If you feel like introducing yourself, either in the chat or coming off of mute, we'd love to hear your name, your pronouns, if you feel comfortable sharing them, and telling us a little bit about what brought you here today and what you would like to learn. So if you feel like writing that in the chat, that way we get to know each other, that would be great. Just to see who's in the room today, in the Zoom room. All right. Thank you all for participating. Switching to Spanish. Tenemos a alguien que dice, como educadora sexual, me gusta mantenerme al día con los medicamentos para la salud sexual femenina. Muchas gracias por estar acá. And now we have someone else. I work for a nonprofit organization as a parent sexuality educator and coordinator. That's awesome. I love seeing people who want to keep learning, want to bring this information to other folks as well. It's super important to share the information that we learn in this space, make sure that it's disseminated with others. Opill is super cool. We are very happy that it is now FDA approved and available for purchase over the counter. So yeah, we definitely want to let other people know about it. That's really awesome. All right, well, if anyone else wants to keep introducing themselves, we would love to see that. Want to learn more about contraceptive care? That's awesome. Welcome, Youth Sexuality Education Coordinator. Yes, we want to make sure that this information reaches everyone who needs it, everyone who wants it. Definitely sharing this with parents, with youth, with everyone, right? We all know someone who would love to hear about Opill. I'm sure people have lots of questions about it. We would love to answer any questions that you all have. You can feel free to leave any questions in the chat. I will say we hope that all of your answers or all of your questions will be answered throughout our presentation. But you can feel free to leave your questions in the chat anyways, and anything that we did not get to or any questions that you still have, we will have some time at the end where you can ask those questions, and hopefully we have the answers for you. But thank you so much to everyone for being here today. We know that you could be doing any sort of thing with your evening, but we know that you chose to spend your time here with us at Latina Institute to learn about Opill. So we're really excited about that. All right, so jumping into it, what is Opill? Maybe you've heard about this, maybe you haven't, but Opill is ever daily birth control pill that is now available over the counter. and has been approved by the FDA to be available over the counter. The FDA is the Food and Drug Administration. So this means that there's no prescription needed and there's no appointment needed. Opill contains only one hormone, which is progestin, and we'll talk a little bit about progestin and what it does and how it works in a minute. But it's really important for us to let you know that Opill does not contain estrogen. So it's also safe to be used by people who, for whatever medical reason, cannot take estrogen. And I'm sure you might also be asking yourself, what's the difference between Opill and Plan B or medication abortion? We know that there are a lot of pills out there. Definitely a lot of you who mentioned you're in the sexual reproductive health space. There are a lot of pills and it might be confusing to tell them apart or know the difference, but there is a big difference between all of these pills and they all serve a different purpose. So birth control pills are taken every day to prevent pregnancy. Traditionally, you need a prescription to access them. And there's different kinds of birth control pills. They might have slightly different compositions, but you can always ask a doctor what the best choice is for you. A morning after pill or emergency contraception like Plan B is only meant to be used within 3 days in cases of unprotected sex, or if your other method of birth control failed, like if a condom broke or you forgot to use a condom one time. Lastly, we have mifepristone and misoprostol. These are used to end pregnancy. They should only be used if a pregnancy has already been confirmed. And mifepristone, while it's not available over the counter, it will be available at certain pharmacies like Walgreens and CVS, but you do still need a prescription, and these are available in states where abortion is still legal. So these are sort of the different kinds of pills and all the differences. And when it comes to Opill, Opill is a type of birth control pill. So it is the first birth control pill, again, that is available over the counter and has been approved by the FDA to be available over the counter. So how does it work exactly? How does Opill prevent pregnancy? Opill, like all other birth control pills, contains progestin, which is the hormone we just chatted about. The way that progestin works is that it thickens your cervical mucus. And what thickening the cervical mucus does is it blocks sperm from reaching an egg. Without an egg and a sperm meeting, embryo cannot be formed. Another thing that it might do is prevent your ovaries from releasing any eggs to begin with. So it's really important to remember that birth control pills do not induce abortion. Contraceptives only prevent pregnancy. It does not, and it cannot terminate a pregnancy. So when we are using Opill, it's super, super easy. You just swallow one pill at the same time every single day. That might be the part that is a little bit less easy, right? Some of us might be forgetful, but if you set a reminder, an alarm on your phone to make sure that you're taking it at the same time every day, that could be really helpful. Another tactic that you can use is to sign up for a subscription. That way, a new pack of Opill is delivered to your door so that you don't miss a pill in between switching packs. So the way that we can start to do this is you can start your first pack of Opill on any day of your menstrual cycle. However, if you're switching from another type of oral contraceptive, a different kind of birth control pill that you've already been using, or the vaginal ring or the patch, any of those 3 kinds of birth control methods, you should start taking Opill the day after you stop that other method. Otherwise, you can start, your first pack on any day of your cycle. And just like any other birth control pills, Opill does not prevent sexually transmitted infections or STIs. So it's really important that if you are also hoping to prevent not just pregnancy, but also the transmission of STIs, that you continue to use barrier methods. So internal condoms, external condoms, and dental dams. Something that is often asked is, how effective is this, right? We want to make sure that if we are choosing a method of birth control, that we are as effective as possible at preventing pregnancy. So great news is that Opill is 98% effective at preventing pregnancy when it's taken at the same time every day. So again, that's really, really important to remember. Like we said, one thing you can do is set an alarm, set up for subscription service as well. Because again, the pill does become less effective if you are not taking it at the same time every day. So we really want to drive that home. Set alarms on your phones. And once you do start taking your first pill, it'll start working within 48 hours. So approximately 2 days after you take your first pill, the hormones or the hormone will have worked its way through your body to begin preventing pregnancy. So in the meantime, you should make sure to keep using a barrier method like internal, external condoms or dental dams for the first 2 days to prevent pregnancy. Or if you ever miss a pill, if you forget to take one, if you take one too late, not at the same time, it's always a good idea to continue to use condoms. I know that people might also be wondering about side effects. Like any birth control pill, Opill does also include some side effects. Progestin-only birth control pills, some of their side effects, you might experience some irregular menstrual bleeding and spotting, especially in between periods. You might experience acne or breast tenderness. You might notice a decreased sex drive, and you might experience depression, headaches, nausea, or develop ovarian cysts. So these are some things to look out for. It's not to say that if you take Opill, any of these things will necessarily happen, but everyone's body is different. Everyone reacts differently to different medications. So if you, this is definitely a place where it could be really helpful to a healthcare provider, especially someone who has an understanding of your medical history, any medical conditions or issues that you're currently experiencing, to make sure to see if Opill is right for you. So now with all of that, where can we find Opill? I'm sure you're all wondering. It is available over the counter, like we said, at most major retailers. You should be able to find it at most pharmacies near you. You can also access it online at opill.com and have it sent to delivery straight to your door. On our next slide, you will see a QR code. And there's also the link in case you're on your phone and you can't scan the QR code right now. You can type that link into your browser as well. And this will help you to locate the closest pharmacy to you that is currently selling Opill. Opill is available to be ordered online. Like we said, it's available at opill.com. And it's also in stores, in pharmacies, like we said. Right now, you will probably see at most pharmacies that it is a retail price of $19.99 for a 1-month supply. You can also buy it in stores or online for a 3-month supply, and that retails for $49.99. So a 1-month supply, like we said, being $19.99, we do recognize that there is still work to do to reduce the barriers that this price may cause, and we really want to ensure that Opill is equitable and accessible to all people who want and need it. And so that is something that we continue to advocate for at Latina Institute, and we'll plug you in with some ways that you can also advocate for this. Knowing that there is a cost barrier to Opill at the moment, there are some ways that you can get Opill for free or at a reduced cost. So Perrigo is the manufacturer of Opill. They are the company that produces them, and they have launched a cost assistance program for Opill. It's available at opillcap.com, opillcap.com. And there are some instructions in there that we will go over right now, but the instructions are available in both English and Spanish on that website. So to receive Opill at a reduced cost or even no cost, completely free, you do need to meet some eligibility criteria. So here's the eligibility criteria to receive it at a free or reduced cost. First and foremost, you are someone who's not currently covered by insurance, either public or private insurance. You must be someone who's living in a household income at or below 200% of the federal poverty level, which right now is about $30,000 for a single person's household. And you need to reside within the US or a US territory. And so this is something that you can do because, we know that the suggested retail price might still be too high for folks to access, even if you do not meet this criteria for the cost assistance program. Or some people also might not feel comfortable providing all of this information. But we do expect that Perrigo, the manufacturer, will launch a second phase of this cost assistance program in the upcoming months. That will include some donation opportunities, and some discounts for young people and students in particular. So we do ask that you stay tuned at Latina Institute for some more information. And you can also go to freethepill.org for information about this and some opportunities to advocate for this as well. That is, we are a part of their coalition. That's freethepill.org. So to determine this eligibility, all the criteria that we just were talking about for this cost assistance program, you have to consent to authorize Perrigo, the manufacturing company, to obtain some of your credit information. We ask that you read the full consent authorization information that is at opillcap.com, which is here on the screen. And then once you do that consent, you will be directed to call the phone number that is also on the screen. And at that point, you would speak with an agent to go through the qualification process. You can call any day, Monday through Friday, from 8 a.m. to 6 p.m. Eastern. That is when folks will be available to answer those phone calls. So here again is the website. You can learn more at opillcap.com. For those of you who do have insurance, we do know that most private health plans at the moment require a prescription to cover any kind of contraceptive. Obviously, one of the perks of Opill is that you don't need to go through your insurance company. You don't need to get a prescription, right? You can just buy it off of the shelves. But, it would be lovely if we could get that covered, right? So right now we do have 8 states, and those are the ones listed here on the screen, that have laws requiring insurance companies to cover over-the-counter contraceptives without a prescription. So those are some states that are requiring that. If you don't live in one of those states, Opill might still be eligible for reimbursement through an HSA or an FSA, a health savings account that you may have, or a flexible spending account. So if you have one of those two, you can be eligible for reimbursement. But we at Latina Institute, through our coalition of Free the Pill, we're continuing to advocate for the Biden administration to require all public and all private insurance to cover over-the-counter contraceptives without requiring a prescription or cost sharing. So again, if you are interested in advocating for this, advocating for the over-the-counter contraceptive to be the most accessible, the most equitable as possible, we encourage you to stay connected, stay involved, and hit up freethepill.org to learn a little bit more about that. So as we wrap up, and if you all have any questions, we'd love to hear your questions. But there's a lot of really great things that Opill provides for us, and so we really want to drive home for you all that Opill is safe. Birth control pills have been considered a safe method of contraception for nearly 50 years. It is also effective. Like we learned, it's 98% effective when it's used as directed. It's accessible and convenient. It allows you to, access birth control over the counter, online, at your pharmacy, all without a prescription or going to an appointment. We know that that can definitely be a big barrier to care for a lot of people. And now, for the first time ever, an over-the-counter birth control pill is also FDA approved. So these are all great things. We are very excited here at Latina Institute about Opill. We're really excited that folks can take their healthcare into their own hands. That these barriers that have always existed, we're starting to chip away at them, and people can have access to this really necessary form of healthcare without these barriers in mind. So we are very excited about it. We hope this has been informative. We do have plenty of time if folks have any questions. Feel free to either write them in the chat or come off of mute. Like we said, this is being recorded and will be uploaded onto our YouTube channel. So if you want to send that link to someone who maybe wasn't able to join us today, if you want to go back and look at it and learn any, just take another look at it, feel free to. But that being said, if you do have questions and you don't want your voice to be recorded, you can feel free to write any questions or comments that you have in the chat. We have one question, and it asks if it's recommended to see a healthcare provider before buying Opill to determine if this is the correct method for a given patient. We definitely recommend, always seeing a healthcare provider, especially if, this is a new kind of birth control that someone might be on, or maybe they have never been on a form of, if they've never been on a birth control pill. We definitely recommend seeing a healthcare provider. Definitely, again, one of the perks is that there are a lot of barriers to getting an appointment to see a healthcare provider. And a good thing about Opill is that it cuts that down, right? You can just go to the pharmacy or order this to come, be delivered straight to your home. However, this is a medication that you are taking. Like I mentioned, everyone's body is different. Everyone has different medical conditions. Everyone has different needs. And, we are not medical providers. And so we do recommend, anytime before you're taking something new, taking something for the first time, and you're not sure how your body is going to react, or you're not sure if it's the right method for you, we definitely recommend, seeing a healthcare provider for sure. Great question. Happy to answer any other questions. All right, next question. Is there any age restrictions for buying Opill in person? To my knowledge, I don't think that there is. Alejandra, do you know if there are or aren't?
Que yo sepa no hay, pero podríamos confirmar de todos modos.
Thank you. Great questions. Any other questions that anyone has?
Acabo de confirmar que no hay ningún requerimiento en cuanto a edad. So there is no age restriction on Opill.
Thank you so much, Alejandra. Yeah, that's great news, right? That's another barrier, definitely for young folks to accessing this kind of care, accessing contraceptive methods. That's awesome. All right. We'll wait a couple more minutes to see if any more questions come up. You can always, check freethepill.org. Like I said, that is the coalition that Latina Institute is part of, that really is at the forefront of over-the-counter birth control. They have been in this fight for a very long time, trying to get this FDA approved. They have so many resources on their website, on their social media. So if you have anything specific that you want to look for, if there's any advocacy opportunities, they also are always mentioning them on their social media and on their website. One more question. Is there a free option for minors that would like to subscribe to receive Opill? Right now, the only way, unfortunately, to get a free or reduced cost package of Opill is going through the process that it seems quite tedious right now, right? That we mentioned of having to meet certain eligibility requirements, going through the consent on the website, calling an agent, and going through that process. So right now, that is the only way to get it, regardless of age, for a free or reduced price. Like we mentioned, though, Perrigo, the manufacturer, is expected to roll out a second phase of this cost assistance program that will hopefully include specific processes or discounts for youth, for minors, for students. And so that is hopefully something that we will see in the coming months. Opill has been on shelves available, in pharmacies and online for a couple of months only so far. So we're still learning as well, sort of what does that really look like. We're at Latina Institute, we're actually gathering stories of people who go into a pharmacy and buy it, and just hearing how that process is. And so again, this is still new. We hope and we're confident that there will be a specific cost assistance programs for youth, for those under 18, for students. So that's something to look forward to. If you're interested in learning more about that, feel free to, reach out to us, keep following us on social media, and follow Free the Pill as well. They'll have more up-to-date information. And then next question, you said this pill does not have estrogen, question mark. That is correct. Opill is only progestin only. It does not have estrogen. The only hormone that it has is progestin. So some people might not be able to take something that includes estrogen. And so this is safe. Opill is safe for people who cannot take estrogen and can only take up progestin only kind of birth control method. Great questions, everyone. Well, I hope that you all learned about Opill. We hope that you, will take this information and share it with other people. Once the recording of this is up on our YouTube channel, you can always, of course, share that and come back to it. We do have a comment in the chat that says some abortion funds, for example, Jane's Due Process and T-Fund, may also provide assistance with contraception costs. Not totally sure if they would definitely cover Opill, but they might. Thank you so much. That is super helpful. Abortion funds are a great resource. folks can reach out to them, even if it's for things, like contraception, even if it isn't for an abortion necessarily. Thank you so much for pointing that out and highlighting that. That's really awesome. All right. Well, thank you so much, everyone. We really appreciate again that you've taken the time out of your evening when you could have been doing anything else to come and learn about Opill. As always, we would love for you to follow us at Latina Institute on all social media platforms. You can also check out our website, latinainstitute.org. We do have a tab on our website that says campaigns, and then on there you can find all the Opill information. All the information from this workshop is also on that tab on our website, so you can always go back to it if you want to keep learning more. But thank you all so much. We really appreciate your time.